Platelets, Microvascular Health, and Glaucoma, What Patients Should Know. Glaucoma is a disease where pressure or poor blood flow damages the optic nerve at the back of the eye. While high eye pressure is a well-known cause of optic nerve damage, researchers are looking at microvascular factors too. That is, how tiny blood vessels and blood cells affect the eye. In particular, they are studying platelets, blood cells that help form clots, and measures like mean platelet volume, MPV, as possible indicators of small vessel trouble. This article explains why platelets matter for blood flow, what the evidence says about platelets and glaucoma, and how you can protect your vascular health to support your eyes. Platelets and MPV, what are they? Platelets are small, disc-shaped cells in your blood that stop bleeding by clumping together to form clots. When your blood vessels or endothelium, the inner lining of blood vessels, are injured or inflamed, platelets activate. They become sticky and release chemicals that attract more platelets and help plug leaks. A routine blood test called a complete blood count, CBC, often includes platelet measures. One such measure is mean platelet volume, MPV, essentially the average size of your platelets. Large platelets are younger and more active. In fact, MPV is a simple, inexpensive, and widely available marker of platelet activity. That means if your MPV is higher than normal, your platelets are more active or hyper-reactive, which tends to promote clotting. Studies in heart and blood vessel disease show that higher MPV is linked to more clot-related events. For example, one analysis found that patients having heart attacks tend to have significantly higher MPV than healthy controls. In other words, MPV can correlate with cardiovascular risk. However, whether MPV actually causes these events or just marks them is not settled. Key takeaway: think of MPV as a flag for how sticky your platelets are. It's an easy test, part of CBC, but by itself isn't a disease. Higher MPV suggests higher clotting tendency, which could affect small vessels anywhere in the body, including the eye. How platelets interact with vessel walls. Healthy blood vessels, and specifically the endothelium, release substances, nitric oxide and prostacyclin, that keep platelets calm and prevent clotting under normal conditions. But risk factors like smoking, high blood pressure, diabetes, and high cholesterol can damage the endothelium. This sets off a chain reaction. Endothelial damage. For example, high blood sugar or smoking creates oxidative stress and inflammation in vessel walls. This reduces the natural anti-clotting signals, nitric oxide, and causes blood vessel cells to express sticky molecules like P-selectin. Platelet activation. In those conditions, platelets latch onto the damaged lining and each other. Inflammatory chemicals and clotting factors pour out of platelets, further activating the endothelium in a vicious cycle. In short, injured vessels plus risk factors equals platelets primed to clot. An expert review notes that low-grade inflammation, endothelial dysfunction, and platelet hyper-reactivity are all independently associated with an increased risk of cardiovascular events. In plain terms, even slight ongoing inflammation or vascular injury can turn platelets into troublemakers. How this affects the eye. The optic nerve head, where it enters the eye, gets its blood from very small arteries and capillaries. If platelets easily form clots or the vessels constrict from substances like endothelin, then tiny areas of the optic nerve might suffer ischemia, lack of blood. In glaucoma, this is a concern. Optic nerve cells need a steady blood supply, and repeated mini blockages could contribute to nerve damage over time. In fact, similar ideas occur in silent strokes in the brain. Notably, many glaucoma patients have systemic vascular issues. For example, people with diabetes or high blood pressure often have compromised microcirculation. Diabetes causes well-known small vessel damage in organs, eyes, kidneys, nerves. Platelets are thought to play a role here. Diabetic patients have platelet hyperreactivity, hyperaggregability, increased thrombogenesis, and decreased fibrinolysis, meaning clots form more easily and dissolve poorly. Large platelets, high MPV, add to that, and in diabetes, they're associated with worse blood vessel injury in the eye. By analogy, any condition that makes platelets clingier, even mild vascular stress, could theoretically harm the optic nerve's microcirculation. What do studies show about platelets and glaucoma? Research specifically linking platelet markers to glaucoma is very limited. Most evidence comes from related vascular diseases, heart disease, stroke, diabetic eye disease. In general, these studies suggest high MPV and active platelets signal microvascular risk, but applying this to glaucoma is still hypothetical. Heart disease studies. We already noted high MPV is linked to heart attacks and artery re-narrowing. Those studies point out MPV can be a useful prognostic biomarker, meaning it flags risk. They also caution, it's not proven that raising or lowering MPV itself changes outcomes. Diabetic retinopathy. A study of diabetic patients found those with retinopathy, diabetic eye blood vessel disease, had higher MPV than diabetics without retinopathy or healthy controls. MPV correlated with blood sugar control too, higher MPV when A1C was higher. This suggests again that active platelets go along with worse small vessel eye disease. Glaucoma studies. There is at least one small case control study, not widely available, that reported higher MPV in people with neovascular glaucoma, glaucoma due to new vessel growth, often in diabetes, compared to controls. It concluded that MPV and related platelet measures were independently associated with that severe form of glaucoma. However, neovascular glaucoma is a special case linked to diabetic vessel growth, not typical glaucoma. No large studies have convincingly shown that MPV or platelet reactivity predicts primary glaucoma, the usual open angle or normal tension types. In summary, we don't yet have proof that platelet metrics cause glaucoma or are useful for predicting it. The link is suggestive but very early. Consequently, experts say do not change glaucoma treatment based on MPV alone. It's an area needing more research. In fact, even in heart disease, the authors ask whether MPV should influence practice or guide therapy, and admit it's unknown. What this means for patients. If you have glaucoma, you should follow your eye doctor's advice on IOP and eye drops. The idea of ordering platelet tests, beyond a routine blood count, is not standard care for glaucoma. But being aware of overall vascular health is smart. Protecting your eyes by managing vascular risk. Even though platelets and glaucoma aren't fully linked yet, it doesn't hurt your eyes and definitely helps your heart and brain to improve vascular health. Here are practical steps and tests anyone can consider. Check your blood pressure. Uncontrolled high blood pressure injures vessel walls and can raise pressure in the eye. Aim for a healthy range, generally under 130/80 mmHg. Many pharmacies and clinics offer free blood pressure checks. Controlling blood pressure through diet, exercise, and medications, if prescribed, helps all microvessels, including those in the eye. Monitor blood sugar. If you have diabetes, keep it well controlled. High blood sugar chronically damages small blood vessels. Tests like fasting blood glucose or HbA1c measure average sugar levels. For example, one study showed that higher MPV went along with higher fasting glucose and HbA1c. Ask for an annual HbA1c test if you have diabetes or prediabetes. Even if you don't have diabetes, maintaining normal glucose through a low-sugar diet and exercise reduces vascular risk. Get a lipid panel. High cholesterol and triglycerides, fat levels in blood, also cause vessel damage over time. A simple blood test at a lab, often called cholesterol panel or lipid profile, tells you your LDL, HDL, and other fats. If levels are high, work with your doctor on diet, exercise, or medications, like statins, to lower them. Lowering bad cholesterol can reduce plaque buildup and inflammation in vessels. Quit smoking. This is by far the most important fixable risk for platelet reactivity and vessel health. Cigarette smoke contains many toxins that harm endothelium and make blood more prone to clot. Studies report that smoking significantly increases platelet stickiness, raising clot-related factors like thromboxane and von Willebrand factor. In fact, one review plainly states, smoking elicits oxidative processes, negatively affects platelet function, fibrinolysis, and vasomotor function. In practical terms, smokers have at least double the 10-year risk of fatal vascular events compared to non-smokers. The good news, quitting pays off big. Quitting by age 40 cuts the excess risk of death from cardiovascular causes by about 90%. Quitting at any age still sharply reduces risk over time. So, giving up cigarettes and avoiding secondhand smoke will calm your platelets and heal your vessels, benefiting your eyes and heart. Improve diet and exercise. Obesity and poor metabolic health drive inflammation, high blood sugar, and high blood pressure, all enemies of your vessels. A balanced diet, Rich in vegetables, fruits, whole grains, lean protein, and healthy fats, and regular exercise help. Even moderate weight loss improves how the endothelium works and lowers blood pressure and blood sugar. This indirectly reduces platelet activation triggers. It's well known in heart disease prevention, and the same principles apply for healthy eyes. Regular blood tests. As part of annual checkups, you can ask for these basic tests: a CBC, complete blood count, which includes platelet count and MPV; a lipid panel, fasting glucose or HbA1c. Also, if you have diabetes, a urine microalbumin test checks for tiny amounts of protein in urine is wise. It's a marker of generalized microvascular damage in kidneys, which often goes along with retinal vessel issues. Discuss results with your doctor. For platelet tests specifically, remember there is no standard platelet activation test you can easily order, aside from MPV on the CBC. Medications if needed. If you already take drugs to control blood pressure, diabetes, or cholesterol, ensure you are adherent. Sometimes doctors consider low-dose aspirin or other blood thinners in patients at high cardiovascular risk, but this is individualized and not currently standard for glaucoma. Don't start any new medication without talking to your doctor. How to interpret these tests in lay terms. A normal MPV varies by lab, but is often around 7-10 feeler. A significantly higher MPV, for example, above 11 to 12 fefila, depending on the lab, could mean your platelets are larger and more active than average. But again, by itself, it doesn't diagnose anything. It's another clue in a big picture. If your doctor says your MPV is high, it's usually seen along with other risk factors like high blood sugar or inflammation, and they would focus on managing those. Remember, the goal is lowering overall vascular risk. If cigarette smoking or untreated diabetes are raising your MPV or damaging your endothelium, tackling those issues is key. Lowering high blood pressure or cholesterol will reduce the stimuli that make platelets angry and sticky. Limits of current knowledge and future research. It's important to be realistic. We still have more questions than answers. Platelet metrics like MPV are easy to get from routine labs, but they're only part of a complicated system. Not yet proven for glaucoma. No major trial has shown that measuring MPV or giving anti-platelet therapy changes glaucoma risk. The existing evidence is mostly indirect, from heart disease, diabetes, and eye diseases like diabetic retinopathy. For instance, while high MPV is linked to more cardiovascular events, researchers explicitly warn we don't know if it causes those problems or is simply a marker. Patient factors, things like age, other illnesses, medications, or even the way blood is drawn can affect MPV. So a single high MPV reading needs cautious interpretation. Doctors usually look at the whole picture: blood pressure, diabetes status, cholesterol levels, eye exam findings, and so on. Need for eye-focused studies. Currently, studies on platelets, specifically in glaucoma, are sparse. More research is needed to answer. Does higher MPV predict who with ocular hypertension will develop glaucoma? Do glaucoma patients with higher MPV progress faster? Could anti-clotting treatments, like aspirin, protect the optic nerve? At this time, there are no clear answers. Research directions. Scientists suggest future studies to measure these platelet markers in large groups of glaucoma patients over time. Also, better tools to see tiny vessel flow in the optic nerve, improved imaging, and lab tests of platelet function might help. But for now, assuming that what's good for heart health, control blood sugar, stop smoking, healthy diet, will also not hurt eyes, is the prudent approach. Conclusion: glaucoma care focuses on eye pressure and monitoring vision, but overall health matters too. Platelet activity and microvascular blood flow are new frontiers being explored. High mean platelet volume, MPV, and overly busy platelets can signal poor small vessel health, which in turn might contribute to damage in the optic nerve's blood supply. Yet, direct proof is still lacking. The take-home for patients is: keep your entire body healthy. Manage your diabetes, blood pressure, and cholesterol. Quit smoking. These steps improve your general vascular health and indirectly protect your eyes. While we await more studies on platelets and glaucoma specifically, the same measures that keep your heart and brain vessels clear will also help maintain good blood flow to the optic nerve. In other words, treating the global vascular risk factors is both sensible and actionable right now. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.